Hello, my name is Sherry. I am a chronic pain management nurse, and today I'll be talking to you about the different fears and myths and the barriers that get in the way of decreasing your pain. One of these fears that you may be familiar with is the treatment or the medication will eventually stop working and I will have increased pain. The mind and the body are connected, so if you believe that to be true, that probably will happen. I've had patients say that steroid injections are helpful for them, but they only last 2 months, and that's exactly what happens. It only lasts for 2 months. I've also had patients say they'll try new medications, but they're sensitive to medicine, so they'll probably have side effects. That's exactly what happens. And so if you believe that a treatment or medicine won't be helpful, that's probably going to be what happens. And you'll have increased pain. Even if there's no actual physical cause for the pain or the increase in pain, because your mind believes it, it can happen. Another fear that people have is that the pain will never end. And this can keep your mind caught in the pain-fear cycle and increase your pain. The truth is that many people learn ways to turn down their pain or to completely turn it off. And for some people, the pain does end, especially if there is no actual physical injury or structural thing causing the pain, or if the pain or if the injury has already healed, it should no longer be transmitting pain. But the mind gets confused and it doesn't realize that the actual cause of the pain is gone, and so it keeps the pain going. In his book, The Way Out, Alan Gordon explains how the brain can misinterpret signals and think that you are in pain when you actually aren't. He knows this from experience. He had over 16 areas of pain, and then when he realized there was no actual cause for the pain, he was able to reverse the pain. So some people do have real structural damage to their body, something that's really causing pain, or they have a real disease causing their chronic pain. But there are many people who, with chronic pain, who do not have these causes. It's actually what they have is called neuroplastic pain, where the brain learns how to continue experiencing pain from a pain that's no longer there, or in some cases the brain actually creates pain that has never been there. But the good thing about neuroplastic pain is that if you believe there is no real physical cause for the pain, you can learn to turn down that pain and turn it off. Alan Gordon has noticed there are 3 things that get in the way of eliminating neuroplastic pain. The first one he calls the biological instinct. It's that instinct that we have developed where we tell ourselves, if I have pain, there must be something in my body causing it. There has to be something in my body to blame. Some people, they're not open to the possibility that their pain could be neuroplastic, so they keep on doing the things, the treatments and the medications that they have found unhelpful. The second barrier is conditioned responses, and the brain can develop an association between a certain position or activity and that results in pain. So for some people, grocery shopping triggers pain. every time they go grocery shopping, they know they're going to have pain. For some people, it's sitting. For myself, the pain trigger is driving an hour and a half home from work. So sometimes I have this pain. The right side of my neck will hurt, my buttocks will hurt, my stomach will hurt. I know that there's no cause for this pain, that for me it's neuroplastic. I only have this pain driving home from work. I don't have it once I'm home, it goes away. I don't have it on the way to work. I don't have it when I'm driving long distances to visit family or long distances driving on vacation. It's only when I drive home from work. And the third barrier, he says, is medical diagnoses. So some people have really scary sounding pain diagnoses like degenerative disc disease, repetitive strain disorder, complex regional pain syndrome. So for some people with diseases like this, they do have a lot of pain, but we're also finding that there's people with these diagnoses that have no pain, or sometimes they have the pain, sometimes they don't. It comes and goes. So these medical diagnoses just reinforce the idea that we must have something wrong in our body, and therefore I need to feel pain because I have this diagnosis. Our bodies are aging, they're declining. Some people feel pain with this degeneration in our body, but there's many people who don't. So if you are interested in learning more about neuroplastic pain and the techniques for how to turn it down or to turn it completely off, then I do recommend the book, The Way Out by Alan Gordon. I also want to encourage you to become more aware of the thoughts that you have regarding pain relief, and that you challenge any fears or myths you have about relieving pain.